مبسوطة كتير.
يلا. So to do knee examination, we have to expose properly the knee up to the mid thigh to inspect the femoral muscles. Okay, we have to start with inspection of the skin, muscle, then joint, and then we do some maneuvers. So first you inspect the skin, see if there is any psoriatic rash, vasculitic rash, any skin scars. You have to mention them bilaterally inspecting. Then you comment on the muscle, see if there is any muscle wasting or they are symmetrical. You have to mention that. You would say there is no wasting of muscles. Muscle bulk looks symmetrical, bilaterally. Then you comment on the joint shape, say if there is swelling or deformity. The deformity we are talking about are valgus deformity, outward deformity, or varus deformity, inward deformity. So after commenting on that, we are going to do palpation. So palpation starts with temperature. So the first thing, you put your hand on the leg, feel the temperature, slide it slowly to the knee so you feel the difference. That will tell you if there is any change or increased temperature of the joint. So after that, you do testing for the pain, and just beside the patella, from up and down, press there and ask if there is any pain. Okay. After that, okay, you feel the posterior aspect of the knee, looking for any Baker system swelling. Okay. Then after that, you examine for fusion, and that is by two maneuvers, either the squeezing, okay, and do patellar tap. You can squeeze and do patellar tap. Okay, squeeze and do patellar tap, of course, like that, and do patellar tap. Or by doing milking maneuver, you milk the medial aspect and press it from the lateral aspect, see if this dimple is bulging or not. And you can do the other side, milk it like that, push it from that quickly, don't wait or do a lot of lag, so just do like that and push it from the other side, see if it is bulging or not. So for example, this patient has no effusion. After we finish a fusion test, we ask the patient to do the active movement of his knee, then we will do the passive one. Ethnic rukbah, he will do it by himself, do the other one. This is the active maneuver, put this down, this one. Okay, so he can do that, full flexion. We do the full flexion, you can do all the maneuver in one step. So put your hand on the knee so you can feel if there's any crips, indicate a degenerative joint disease, and do full flexion, look to the patient face, and if there's any comfort. Okay, don't leave the hand till you do extension, just see if there is hyper extension, indicate hypermobile joint. Then you do examination of the medial and lateral collateral ligaments, and then you examine for anterior and posterior cruciate ligament. Put your hand, arm on his foot to stabilize it on the table, and your finger below his knee, behind his in the popliteal fossa, and your thumb on the tibial area, and try to pull it outward to see if it's coming out. If it is coming out, that is the anterior cruciate ligament. Tear and push it down to examine the posterior cruciate ligament. By this, we finish examination of the knee. Okay, thank you.